Ayurveda and Yoga Management of Chronic Alcoholism. Sequel. A Case Report. This is a journal of Ayurveda and Integrative Medicine. Printed in the National Library of Medicine, NIH. Abstract. Alcohol has always been a component in the dietary pattern of human civilizations. It's widely used in society for celebration and socialization. Alcohol abuse is among the most serious problems in public health, characterized by uncontrolled drinking, which causes physical and emotional dependence on alcohol. Chronic alcoholics have a higher risk of developing vitamin B1 deficiency due to malabsorption, poor diet, and an increased demand for nutrition. Vitamin B1 thiamine is an essential nutrient required for the body's energy metabolism and proper functioning of the nervous system. A person who excessively consumes alcohol and then abruptly discontinues drinking and takes recourse to drinking excess alcohol again suffers from chronic alcoholism, that is, vikshay. Here's a case report of an alcoholic patient who ceased drinking and then resumed alcohol in large amounts. He presented with the symptoms of generalized weakness, body ache, aphasia, confusion, fever, on and off, thirst, cough, headache, and numbness. The patient underwent a 2-month treatment regimen that combined Satyava Chikitsa Yoga and Shama Chikitsa, involving Rasayana medications and procedures, including Snahan oleation, Svedan fomentation, Nadi Puran, filling the navel with oil, Asai, nasal administration, Sharadharha, continuous flow of liquid on head, and Basti, medicated enema. The intervention outcome showed relief from the aforementioned symptoms and improvement in both symptoms and GCS, Glasgow Coma Scale score. This treatment approach aimed to promote vitality, longevity, and an overall sense of balance and well-being. There are not many corroborating cases being reported and managed with Ayurveda, and this case report highlights transforming health through the cumulative effects of Rasayana medicines, Panchakarma, and yoga. 1. Introduction. Liquor is described as amritam, elixir, when consumed adequately, but when consumed improperly causes disorders, depicting its intoxication symptoms. Similarly, a poison, when used sensibly, can be life-saving. Heart is a site for channeling the rasa dhatu, the nutritional fluid produced immediately after digestion. Sattva, mental strength, buddhi, intellect, indira, senses, atma, self, and ojas, the vital essence of the body. Madhya, with its 10 qualities, brings the hridaya by counteracting the 10 qualities of ojas. That's alcohol opposes the qualities that we want. The excessive drinking of liquor and gradual impediment of ojas affect the heart and the dhatu located in the heart. These properties of alcohol are lagu, lightness, raksa, dry, tikshna, penetrating, ushna, hot, sukshma, diffusing, amla, sour, vivya, absorbs without undergoing digestive changes, asakari, fast-acting, vakasi, breaks the internal tissue barriers, and visada, clearing channels. In this case report, the patient was economically poor and was a laborer who used to carry loads, and the patient consumed excessive amounts of alcohol without an adequate diet. This resulted in malnourishment, and the patient started experiencing body ache, aphasia, confusion, fever, thirst, cough, headache, numbness. In Ayurveda, these symptoms state a condition that can be correlated with vikshay, madhyaya, upadrava. Also, as stated by Charaka, the one who starts consumption of liquor in excess quantity after abstaining suffers from the disease of vikshay. The treatment of vikshay has been indicated in Charaka Samhita as per Vatika Madhyaya. Ayurvedic oral medications with panchakarma along with yoga and lifestyle modification have shown significant improvement in reversing the pathological condition. 2. Patient information. The 71-year-old male patient reported at the outpatient department of the Chikitsa General Medicine Ayurveda, the Dr. Patil College of Ayurveda and Research Center. He presented with generalized weakness, body ache, aphasia, confusion, fever on and off, thirst, cough, headache, and numbness. Family members claimed that the patient used to speak about fictitious incidents which never occurred. Wet brain. He was a player for the IPL matches and somewhat claiming himself a film actor, etc. The history of the patient revealed that he was a chronic alcoholic and used to consume 180 milliliters of country liquor from the age of 14 years and was habitual to drink alcohol frequently. And before 2 years, in the 2020, he abstained from drinking for some months and later again started reconsuming liquor daily. And the patient had no history of any systemic illness like hypertension, diabetes, mellitus, tuberculosis, etc. And he was not on any medication. He had taken some Ayurvedic medication in his village as he fell ill with excessive alcohol consumption and later discontinued. No data was available about his medication. On examination, the patient's pulse was 80 beats per minute, blood pressure 130/80, and a weight of 170, height of 175 centimeters. Severe pain in the body, throat disorders, confusion, fever. Idiopathogenesis. Excessive consumption of alcohol with inadequate diet and workload, all of these causative factors that lead to viviation of the 3 doshas, which lead to anavoha, strodushti, and agni mandya. The opposite and the dusha of the traverse, they inflict the hidara, causing ojo vikruti. Similarly, the tikshna, ushna, and amla guna of madhya leads to pitta and vata dashti, causing inflammation of the mucosal layer of the stomach and colon, causing a reduction in the absorption of nutrients, particularly vitamin B1 thiamine, which causes symptoms like numbness in limbs, muscle weakness to mental and neurological deficits. Riksha and luga guna of madhya vitiate the vata dosha, leading to maja dhatu kasha, causing symptoms of nutritional and neurological deficiency, body ache, and weakness. It further inflicts the manhava strotas, where sattva guna is reduced and the raja tamas guna increases due to alcohol consumption, leading to madachada, which further leads to vikshay as upadrava. Lifting heavy loads causes the aphasia, a reduction of strength, uja, and intelligence, along with the decrease in grasping power and memory. Excessive alcohol consumption causes metta dhatu kashay, which leads to loss of strength. And we have other factors involved in the pathogenesis of chronic alcoholism. Therapeutic intervention. The madhyaya upadrava, or the stages of the alcoholism, appear as Krishna, emaciated; Durbala, person's weak; Acharya Charaka described the treatment of vikshepa similar to Vajrayana. The therapeutic approach involved the Sattva Chikitsa and yoga, the Shaman Chikitsa, Shodhan, and the Shodhan Chikitsa. Sattva Chikitsa and yoga. Acharya Charaka quoted the Sattva Chikitsa as saying to control the mind and withdraw the mind from unwholesome objects which cause disease. Sattva Chikitsa can be used for the treatment of Madhachara, where the balance of the Raja and Tamas guna is achieved by the control of the urges to be controlled. Yoga was used by Sattva Chikitsa, which emphasizes the principle of Chitta Vritti Nirodha, which means controlling the mind from different unwanted thoughts. During the recovery period, alcoholics often experience cravings of alcohol due to the withdrawal of alcohol. Yoga emphasizes mindfulness and increases body awareness and mental clarity and calmness. The reduced craving for alcohol with increased self-control, and in this phase, Ashtanga Yoga helps patients build strong willpower that helps them achieve sobriety by balancing the mind and body while executing various positions or asana. Regular practice of the asanas like Shavasana, Tadasana help the patient to become more aware of his body and sensations, allowing him to develop a deeper understanding of his physical and emotional states. Asana helps the patient manage his emotions by reducing stress and improving relaxation, thus resisting the urge to drink alcohol. Pranayama breathing exercises was also advised for calming the mind. It increases the circulation of blood to the brain and regulates breathing and movements, which improves self-regulation and impulse control. The yoga session lasted for 45 minutes, and practices implemented in the yoga module are mentioned in the below table. We had the module for holistic healing and alcohol addiction recovery. We have a prayer, starting yoga with the prayer, loosening practices, and joint freeing exercises could be substituted. We have fingers and wrist bending and rotation, elbow, shoulder rotations, hip loosening, knee and ankle and toe movements. Breathing practices, pranayama, anuloma viloma pranayama, ujjayi pranayama, and brahmari pranayama. Simple yogic poses or asanas, Shavasana, Tadasana, Chatukraksasana, Balasana, Shishakasana, Virasana, Gumbhasana, Sinhasana, and meditation. This could be Om chanting. Shamana Chikitsa. The treatment plan for 2 months comprised the use of the capsule Rasayana Ashwagandha and Yashtiti Churna and Shri Khandasava. Akangavir Rasa was administered for 1 month, followed by a 2-week pause, and then resumed for another 2 weeks. Shodhana Chikitsa. The treatment regimen included Snedhan, Sweden, Nasai, Nabri Puan for 2 months, Basti for 3 weeks with 1 week gap, and Shirodhara for 1 month. The patient received Snedhan using lukewarm Bali Talia for 20 minutes, followed by 10 minutes Swetam using Dashmula Bharad for 2 months in the morning. The Desai procedure was done by massaging Bali Tala onto the face, neck, and forehead, followed by mild fomentation and then installation of the Balatali 6 Bindu into both nostrils. The patient was advised to spit secretions, if any, and the procedure of Shirodhara was performed, wherein the patient was directed to lie down on a comfortable bed, and the thalia was then slowly and gently dripped onto his forehead and scalp in a rhythmic, oscillating motion. The patient underwent masturbasti with 8 milliliters of thalia after breakfast and later in the evening. Nadipiran was performed by filling the navel with Bali Atala. Follow-up and outcomes. Severe body pain was evaluated using the VAS scale. It was initially at 6 in the first 3 weeks, decreased to 3 in the following 3 weeks, and eventually reached 0 by the 7th week. The mini-mental state examination was used to assess the confusions, and the MMSE, a score between 24 and 30 indicates no cognitive impairment, while a score between 18 and 23 suggests mild cognitive impairment, and a score between 0 and 17 indicates severe impairment. In the initial 6 weeks, the score was between 18 and 23, indicating mild cognitive impairment. However, over the last 7 and 8 weeks, there was a gradual improvement of his mental status, and the score reached 28, indicating no cognitive impairment. Shirashola headache was evaluating using a VAS scale. It registered a score of 3 in the first week and subsequently diminished to 0. In the first week, Jara fever ranged from 100.5 to 102.2 with on and off onset. Subsequently, there was no more fever episodes. The B1 vitamin, the level rose from 1 to 2 during treatment. The Penn Alcohol Craving Scale is a unidimensional scale assessing craving for alcohol, including the frequency, intensity, and duration of cravings. It's a 5-item self-report questionnaire with scores for each response ranging from 0 to 6, and higher total scores suggest higher levels of alcohol cravings. PACS scores of less than 15 indicate mild craving. 15 to 20 suggest moderately difficult cravings to resist, and more than 20 indicate very difficult cravings to resist. During the initial 3 weeks, the PACS score ranged from 15 to 20. Subsequently, in the following weeks, 4th, 5th, 6th, and 7th, the PACS score gradually decreased to 9, indicating the impact of Ayurvedic treatment. In the last week, the score reached 1, signifying the absence of craving. Before treatment, the patient had apshatavaka aphasia, with reduced ability to speak or comprehend words, which improved to normal speech after treatment in the last week. On admission, the patient exhibited intense thirst, which persisted despite consuming water during the initial 2 weeks. Subsequently, in the 3rd and 4th week, the excessive thirst subsided after drinking water. Throughout the 5th, 6th, and 7th week, the thirst reoccurred at brief intervals, returning to normal intervals in the last week. During the initial first week, the patient had frequent coughing, which did slightly interfere with usual daytime activities. The second week, there was occasional cough for a short period. However, starting from the 3rd week, there were no episodes of coughing, and during the initial 5 weeks, numbness was occasionally. However, from the 6th week onward, there was no occurrence of numbness. The symptoms mentioned above exhibited weekly improvement, culminating in overall relief by the 8th week. Discussion. According to the assessment, the symptoms of the patient was well managed by the holistic approach of Ayurveda and yoga. The treatment principle of Vikshay is similar to the Vitaja Vadataya Chikitsa. Vata dosha was pacified by internal Ayurvedic medicine along with Ayurvedic therapies and yoga. Medicines like Capsule Rasayan, Shrikad Sava, and Ekanjerva Rasa were pacified the vitiated Vata dosha, improving the Agni or the digestive fire and the Bala of the patient. Vachita Churna enhanced his speech and memory and relieved his cough. Panchakarma was adopted on the principle of Santapana and Brahmana Chikitsa. Snedhan Sweden, followed by Nasai, Basti, and Nabrapuram, enhanced the nourishment of the body and balanced the vitiated doshas. Yoga relieved his mental stress and brought up stability and mental well-being and improving the sattva guna. Proper counseling and the practice of yoga improved his physical health by increasing strength, flexibility, and balance, and this led to an increase in his confidence and self-efficacy, which improved his ability to resist alcohol craving. After 2 months of vitamin B1 increased from 1 to 2, and the GCS score improved from 13 to 15. The rationale of treatment focused primarily on the principles of pacifying elevated vata dosha, the satipana and brahmana, and the probable mode of action of the treatment is as follows. Capsule Rasayan has Gaduchi, Gukshura, and Amalaki. Gaduchi serves as a memory enhancer with lots of antioxidants promoting anti-aging and immunity properties. It also supports liver health to regenerate liver tissue and helps to eliminate toxins from the body. It's beneficial in maintaining harmony of all 3 doshas, especially Vata and Pitta. It's found effective in treating neurological disorders like amyotrophic lateral sclerosis, Parkinson's, dementia, motor and cognitive deficits, and neuron loss in the spine and hypothalamus. It's also used in the treatment of fever. Gokshuro is an antioxidant that reduces inflammation and pain and improves libido and weakness of the nervous system. It's usually given in urinary problems, but also strengthens cardiac muscles and prevents arteriosclerosis. Also, it's effective in improving memory, concentration, and alertness. Amalaki is loaded with vitamin C, a powerful antioxidant with anti-aging properties and improves immunity. It eliminates stress and weakness, maintaining healthy function of the liver, heart, brain, and lungs. Ashwagandha modulates stress and anxiety. It improves strength and immunity, improves cognition and memory functions, and it's rejuvenating, anti-inflammatory, and anti-arthritic. It is used in Ayurveda as a rasayana or adaptogen. Yadi Churna has Pipala, Yatamadu, Vacha, and Akarkam. Pipala is a good antioxidant with immunomodulatory, hepatoprotective, anti-inflammatory, and analgesic properties. Yadi Madhu is anti-inflammatory, improving immunity, relieving stress, and soothing the respiratory ducts. It also improves liver functions. Vacha has cardioprotective and neuroprotective activity, thereby enhancing learning and memory-enhancing activities. It also has antidepressant activity, along with antioxidant, anti-inflammatory, and immunomodulatory effects. It improves speech, enhances voice tone and quality, and hence is useful for throat disorders. Akarakamba has anti-inflammatory, analgesic, and sialagic activity. It's a nervine tonic that improves cognitive functions. Sri Kradasava is generally used for the treatment of cases having adverse effects of alcohol or to neutralize the effect of intoxicating drugs or the hangover effect. It also reduces the alkalinity of the hara rasa produced due to excessive alcohol intake. Ironically, it also contains alcohol. It also reduces excessive thirst. Ekanjir rasa is used in neurological disorders, relieves pain, and stimulates the nervous system. It pacifies vata kapha dosha and nourishes the body with its rasayana qualities. Procedures like savanga snehan nourish the body, making it strong, and relieve the body aches by pacifying vata. Sarvanja sweatam improves blood circulation in the body, clears the strota rota, and balances vata kapha dosha. Snedham and sweetam provide psychosomatic well-being. Nasai is the installation of medicated oils into the nostrils. Nasai with Bali Talia has snigdha properties that nourish the tarpak kapha and thus promote a healthy brain and nerve function. Basti is said to have multidimensional effects when administered. Matra Basti with the Bali Talia pacifies the vitiated vata dosha, nourishes the Maja Dhatu, and promotes normal functioning of the nerves. Matra Basti promotes the functioning of the normal bacterial flora of the colon, thus regulating the body's synthesis of vitamin B1. Studies have shown that after taking Basti, there's a decrease in pyruvic acid, a component of keto acid. This decrease in pyruvic acid leads to an increase in vitamin B1 levels. Shirodhara with Jatamansi Talia provides a feeling of relaxation and well-being. It relieves headaches and mental exhaustion and calms the nervous system. Dabi is the seed of Udanvayu, and Udanvayu is responsible for Bala, Vana, Ojo, and memory. The vitiation of Udanvayu caused by lifting burlaps is pacified by instilling the Bali Talia in this. Nourishes the Udanvayu and thus improves Bala Oja's speech and memory.